Hello and welcome to another episode of Journey of Giants. This is your host Megha, and today we are celebrating World Breastfeeding Week with a very special guest. Joining us is Dr. Suja Moorthy, who's a renowned pediatrician with extensive experience in child healthcare. It's a pleasure to have you on the show, Dr.
Hello,
Moorthy.
Megha. Me too. My pleasure.
So, before we dive into the specifics of breastfeeding, can you tell us a bit about how you decided to become a pediatrician? What inspired you during your early days in medical school?
Joining pediatrics was not a very different thing for me, but joining medicine was. So I was always a very studious child, and studies was the only thing I used to do. So between around 10 to 20 years of age, I would be more interested in studying. So other children have various hobbies, like painting, but my hobby was to study. So if you see, I was a bookworm
Okay.
actually. So most of the time you would find me with books, always studying, and I loved it. Nobody forced me to do it, and my parents wanted me to take MBBS. So that's how my journey as a doctor started. Then it was very smooth because I love interacting with people. Science is very interesting. It's my forte. Pediatrics happened
Wow.
because, see, even after, so we finish our course of MBBS, and then depending on those marks, we have to choose what we want to do in PG, or depending on any interest if you have. So even then, I did not have any particular interest, but I was sure I didn't want to do surgery
Wow.
because as a student too, I was very frail, and I used to almost faint in the operation theater. So I knew that I'm not going to do surgery because I'm not going to be able to stand for so long. So medicine was my forte, and I said I'm going to become a
Okay.
medical doctor only.
Interesting.
And then I chose pediatrics, and then it happened.
Awesome. So, even I had science in my 12th grade, and I can totally relate to what you're saying.
Oh, very.
So, were there any specific experiences that made you choose pediatrics as your specialization? For example, like you shared that you were not interested in the surgical part of it.
Because I like children, and I felt there was some charm and attraction in me. So it's always nice to see children. So even though they're sick, when they get well, they're nice. They're jumping around, they're smiling, and the other branches did not attract me much. So that is how I joined pediatrics. But once I joined, I really used to find it interesting. All the number of and not to boast, but in my 24 years of practice, I still remember the names of my patients.
Wow,
They
that's
must have
beautiful.
grown up like they must be 11, 12 year olds, but usually, so parents are also
Right.
surprised, आपको कैसे नाम याद है इतने साल में? So it's kind of that, yeah, attraction towards children, and it just sticks in your mind. So I've always loved being
Okay.
with children. At times it's difficult when they are seriously ill and when you have to treat them, but that's a part of their life and our lives.
I think आपका जो science and बच्चों के लिए प्यार है that kind of pushed you to choose this
Yes,
field.
yes.
And I see that you have such impressive credentials. And how do you uh, evolve as pediatrics with each degree?
As we start
Okay.
studying, everybody knows doctors have to keep studying,
Okay.
keep studying, keep studying. So it's a phase that never stops. We never put a pause or a full
Okay.
stop. Now it's increased even more. So after MBBS, like I said, automatically I did my MD pediatrics. I joined Nair Hospital, which is at Bombay Central Municipal Hospital. And during that course, only we give a series of exams. That is the
Wow.
FCPS and the DCH and the MD, and those exams give us different degrees. So even in pediatrics, I was a very good student and I did well in all my exams. My teachers were very proud of me. So that's how I completed all my accolades and built up my
Wow.
degrees.
Awesome. So now that we have got to know about how you started, I would urge all the couples or new or expectant parents to watch this episode till the end, because we are going to cover a lot of questions that parents have during pregnancy or what they should do for a healthy baby. So Dr. Suja, I am sure new parents के काफी questions रहते हैं. Can we cover all these common questions one by one?
Yes, sure. So this actually starts from the right from before conception. So it's a pre-conception area now. So as soon as the couple gets married and they decide they want to have a baby, they are guided into the
Right.
process of assessments, tests, and counseling sessions for that. So in since I said I've been practicing since around almost 20-25 years now.
Mm-hmm.
Previously, around 10-15 years
Mm.
back, we had many young mothers. So the f-
Okay.
late females would get married at between 25-30, and they would conceive
Okay.
between 30 and 35.
Hmm.
But now the trend is
Awesome.
pushing the age group a little bit higher. So everybody prefers, takes
Awesome.
time, they study, they get settled, and by the time they start marriage, the marriage happens is 30-35, and by the time they decide they want to have a child, it's 35-40. So
Okay.
as the age of the mother increases, there are
Hmm.
lots of complications may happen with the pregnancy, with the child. So a gynecologist usually takes
Okay.
care of this. So as the child mother's age advances, there are various tests to be done.
Hmm.
Preconception also there may be tests to be done. If suppose like if the parents belong to a particular community, from Pakistan, or we have community, those children, if they have any hereditary illnesses, so then
Right.
the parents have to be tested for that, the mother and the father, so that we have to see the trait if they have any illnesses in them already, which may not have manifested. But if the child is born
Hmm.
of these two couple, then the child may manifest. So this phase, this era is a little difficult because lots of things happening. Plus, after
Okay.
COVID, there are a lot of psychological issues, infertility issues. Plus, addictions are very high now in young girls also. Smoking,
Okay.
alcoholism, that leads to other problems in the body, which may affect. So, all this has to be taken care of before conception. You can't conceive and say, now I have a baby, now tell me what to do.
Okay. Right. So yes, obviously planning is important before conceiving a child.
Yes.
I want to know more about this, as how does it work? Ideal timeline क्या है for consulting a doctor? Should it be 1 year or 2 years before attempting to conceive? I mean, how does it work?
Yeah. So ideally, what happens is immediately after marriage, a couple should go and meet the gynecologist and plan their what do they want to do. So if they do not want to conceive, then they have to take contraceptive pills or devices. And if they want to conceive, then the gynecologist usually tells them, advises them, what is the right time, what are the different tests you need to do. There are blood tests also to be done. There are medicines to be taken. Some vaccines have to be taken, preventive vaccines, injections, so that the child doesn't get any infection. And there are these folic acid tablets, which we generally give all mothers who want to conceive, so that the babies don't have any serious neurological deficit or
Okay.
any other problem. So because if the child, so usually what happens is once the lady conceives, there is something known as an antenatal scan. One is when you
Hmm.
confirm the pregnancy with the sonography. Then at 20 weeks, what is done is an antenatal scan for to look that the baby is normal. So the heart is
Hmm.
normal, brain is normal, kidneys are normal. And if that is abnormal, then they have to go ahead for a
Okay.
dropping, for a miscarriage, abortion. So that is why all these tests and medicines and vaccines are important, so that you don't have to go through that trauma of doing all this, so that you
Hmm.
can have a nice normal conception and a good healthy baby and normal delivery. Yes,
I think if we compare
yes,
and
yes,
go
yes.
20, 30 years back
Absolutely,
when I was born, there were lesser complications. पहले बच्चे घर पे भी हो जाते थे. Even I was born at my
absolutely.
home. Yeah.
Okay.
So now, how you mentioned, there are a lot of factors including age and increased use of substances. So, what advice you would like to share with new or expectant parents to have a healthy baby?
So there are preventive vaccinations and preventive medicines which are given. One is folic acid, which I said, no? It's a folic acid tablet to prevent any neurological deficit in the baby. So usually this is started once the lady decides that, okay, now I want to plan and have a pregnancy, which may happen in 2 months, 3 months, 4 months, how much ever time. There are vaccinations which are taken, so like the flu vaccine. So any high fever or any infection we have seen after COVID, everybody's immunity has gone a little down, yeah? Especially in cities like Mumbai, where the crowd is also overcrowding, pollution. So everybody is prone to getting high fever, dengue, malaria. So high fever in the body can cause a miscarriage. So the way to prevent infections is how we immunize children. You know, we give them different vaccines. So even mothers are given, ladies are
Okay.
given flu vaccine.
Hmm.
There is also tetanus vaccine, which is given after they conceive.
Okay.
So these are the preventive aspects from our side. Now, what the couple can do is, see, even though it is our
Right.
duty to explain that this can happen, this can go wrong, you monitor this, but they have to be absolutely calm, at peace,
Hmm.
try to maintain normalcy, and have the pregnancy. That is always in the best interest of the child. Maintain good nutrition, try and exercise,
Hmm.
whatever, not vigorous exercise, was as recommended for your health and as per your
Hmm.
gynecologist. So continue exercising, maintain a normal
Okay.
lifestyle, avoid taking too many medications.
Hmm.
Avoid taking any substances, preferably they are not to be taken, and maintain a normal lifestyle. Like we
Right.
used to have before, not many people had diabetes and hypertension. They were not on medicines. So that is
Okay.
all those diseases have to be under control
Okay.
if the lady decides that she wants to get pregnant.
Okay. So you mentioned along with the kid, even the mother has to take certain medications. And I'm
Yes.
not sure पहले भी ऐसा कुछ होता था?
नहीं, पहले नहीं होता था। पहले सिर्फ टेटेनस का इंजेक्शन देते थे। प्रेगनेंसी होने के बाद एक देते थे। अभी 2 टेटेनस का इंजेक्शन देते हैं और फ्लू वैक्सीन जो है, पोस्ट कोविड वी रिकमेंड नाउ
Okay.
वी स्टार्टेड रिकमेंडिंग फ्लू वैक्सीनेशन दैट इज अगेंस्ट इन्फ्लुएंजा to all pregnant mothers because they come in the high risk category. So the flu
Okay.
vaccination is recommended for all high risk
Hmm.
category people. So children under 5 years, elderly people over 60 years, those who have any illnesses like diabetes,
Hmm.
blood pressure, cardiac illnesses, immunocompromised, kidney
Okay.
transplant, liver transplant, and pregnant women. So it is recommended they're giving so that their pregnancy doesn't cause any issues to them. They are also healthy, the baby is also healthy.
Okay. So as far as I can understand, these changes in dynamics have happened after the pandemic?
More of after the pandemic, but because the lifestyles also changed, stress levels have increased. No, it's all been one transition. In the
Okay.
past 5, 6, 10 years, you can say, the transition started, then COVID happened, and then the transition has been worse.
All right. So you mentioned vaccination is important for both mother and the kid right after delivery. Is there anything else they should keep in mind एकदम delivery के बाद?
So during pregnancy, they also have to take good care of their
Okay.
body. So when the women, so it's a
Hmm.
9 months pregnancy. During 9 months, you have different stages. So it's known as 3 trimesters. First 3 months, next 3 months, and the last 3 months. So first 3 months is when the baby's organs are being
Okay.
formed inside. So the baby is being formed, hand, leg, heart, brain is formed. So again,
Hmm.
that is why the folic acid tablets are important. Good nutrition is important so that the baby is normal. Next 3 months is when the babies and the mother are getting used to them. So the baby's weight increases. He
Hmm.
starts moving. You know. You come to know the liker increases. and further growth. And the last 3 months is when the uterus is getting ready. So the body is getting ready for the delivery to happen.
Mm.
So this is what inside happens inside. And outwardly also there are a lot of changes which
Mm.
mothers go through. Obviously they put on weight. You know. They have stretch
Mm.
marks. They have pigmentation. Some of them have
Mm.
pigmentation on their cheeks. You know. They may have hair fall. They may have mood swings. You know, they may have cravings to
Okay.
eat. Some of them have a lot of nausea, vomiting, ultiयां होता. They are not able
Mm.
to retain anything. तो कुछ भी खाना नहीं जाता है सिर्फ पानी तो ये सब भी हैंडल करना रहता है so ideally pregnancy is like a multitask approach from everybody
Okay.
not only the mother the father the relatives the parents all of them have to be
Mm.
involved.
See that 1 in 5 new mothers experience postpartum depression and ये condition काफी overlook की जाती है. And you mentioned that हमें regular exercise करनी चाहिए, proper nutrition लेना चाहिए. Is there anything else that you would like to suggest so that they can take care of their emotional well-being during this time? ऐसे कुछ therapies or treatments or anything that you would like to suggest?
Yes. So let's see what is the cause of this. No? So usually the cause of sometimes it may not be without any reason also. Depression doesn't always have a cause, but most of the time it is because these mothers compare themselves with others.
Right.
Now
Yeah.
social media can be a boon or a bane. We all know that. So with the number of what are the TikTok videos and YouTube shorts coming up of different people,
Hmm.
celebrities bringing up their
Hmm.
children, ideal mothers, ideal
Hmm.
body, lost weight in 3 months, became fit,
Hmm.
and good, nice, chubby children who are always healthy. So this is what puts
Hmm.
them a little more,
Comparison.
in depression. They're comparing. Why am I feeling like this? Plus sometimes relatives and parents
Okay.
unknowingly they cause this when they compare. So we see a lot of mothers feeling this.
Hmm.
So first thing I tell them is you switch off
Hmm.
your phone once you
Hmm.
deliver. I don't want you to be on social media, and if at all, you just contact your friends, read some nice books, listen to good music, then you feel good. But don't read any medical material or try listening to things when you are pregnant and delivered. You do it before, it's fine. Once you're in the process, you should not try and read because what happens is you start comparing all of it with yourself. And Google Auntie is the worst. We always, doctors, we say Google Auntie is the worst. You put one symptom, it diagnoses. You say, I don't feel like eating, it will diagnose you as depression.
Right. Depression
So,
or cancer.
cancer, exactly. So, I feel, family help, friends, support is more important. And what is happening now is initially we used to have joint families. तो चाचा चाची तीन चार फैमिली साथ में रहते थे बहुत सारे बच्चे होते थे तो पीपल वर देयर टू हेल्प कुछ ना कुछ बनता था खाना बनता था ऐसे चलता रहता अभी कैसे ओनली हस्बैंड वाइफ शिफ्टेड टू सिटीज दे आर
Okay.
अलोन नो हेल्प
Hmm.
मेड इशू then maybe parents can't come because of old age illnesses so that makes them isolated so when you're in pregnancy is a phase when you need people around. No? There are many things
Right.
you can't do on yourself after delivery. So you need help from people. When you don't have, then you feel depressed because lack of sleep,
Hmm.
lack of time for yourself. You can't pamper. There's no time to comb your hair also. There's no time to have a lavish bath. So all these small things impacts your
Hmm.
mental health. So we have to understand these things. What happens usually? What we
Hmm.
do is we have antenatal classes. So a lot of
Okay.
antenatal classes. Usually the gynacs they have a pediatrician also
Hmm.
coming over, and we have antenatal classes in which
Okay.
we explain about pregnancy, explain about
Right.
breastfeeding, explain how to take
Hmm.
care of your body before, what to expect. Don't expect miracles. The baby initially the way
Okay.
baby will feed and everything will be smooth. Be ready
Okay.
just like they have antenatal exercises, so the antenatal yoga, and water aerobics and all. So same way we have antenatal classes. So those antenatal classes and are good to go through.
Okay. So you mentioned that they should read books and avoid social media. Are there any books that you would like to recommend to new mothers, especially during this time?
Yes, there are lots of books by
Okay.
renowned pediatricians, gynacs, which one is Dr. Anand. He is very famous. He's written a book on how to take care of children, written a book on how to manage breastfeeding, and
Okay.
but generally the books by authored by doctors are always genuine. The ones written by lay people who think that they
Hmm.
know better is usually wrong.
I mean, because doctors know better,
Yes,
they are the ones who are taking care of
treating,
you,
yeah,
treating
and they
you.
can give
Yeah.
genuine advice.
All right. So from infrastructure point of view, we understand कि public areas में कोई proper designated places नहीं है. And I have only seen a few temples in Bombay where there are proper feeding areas. But apart from this, if a mother has to feed the baby, they either go to the washroom, which is not hygienic, or they cover themselves up with the scarf, which I'm not sure if it's good for baby, if he or she is feeling uncomfortable or feeling suffocated. So, as a pediatrician, I want to understand your take on this कि गवर्नमेंट को इस इशू पर किस तरीके से फोकस करना चाहिए.
So IAP, that is our organization, Indian Academy of
True,
Pediatricians,
true.
has very strongly put this across, and the government is definitely doing their best to
Hmm.
provide infrastructure for breastfeeding rooms, which are usually
Hmm.
mandatory in all of these areas where the waiting time is too much. So, like you see in airports
Hmm.
or railway station, you have a designated breastfeeding room, which is not in the washroom.
Okay. But at the airports, I have seen ladies rushing to the washroom with the kid.
That is outside the washroom. There usually they have a diaper changing area. That is where they go to. But nowadays even breastfeeding rooms are separate. Just like smoking rooms, you have breastfeeding rooms which have to be there. It's mandatory. Even at the railway station, they have to be even the hospitals have breastfeeding rooms. So even in our hospital, we have outside our pediatric OPD, we have a designated enclosure where
Okay.
breastfeeding, it's a
Hmm.
breastfeeding room. But personally, I feel that you can breastfeed your
Okay.
baby anywhere. You don't have to be embarrassed in this. Covering the baby does not cause any smothering because you're just lightly putting a cover.
Right.
You're not closing total air contact. We all have done this. Initially, when our children are
Hmm.
2022, there were no rooms. So we would just carry them anywhere, put a dupatta and feed them. So there is no shame in breastfeeding. We don't have to think that
Hmm.
we need a room. If there is a room, well and good. If not, we do it as
Hmm.
our comfort. That's my personal opinion.
Okay.
But the government and IAP are definitely working, and wherever possible,
Hmm.
they're trying to provide breastfeeding rooms.
Okay, all right. So we were doing our research and we found out that in 2022, a lot of kids under the age of 5 years जो ठीक से बढ़ नहीं रहे थे 149 million were too short, 45 million were too thin, and 37 million were overweight. Only about 44% of baby under 6 months are optimally breastfed. So इन सबका क्या रीजन हो सकता है, क्यों इतना गैप है, एंड हम इस सिचुएशन को कैसे बेटर कर सकते हैं.
So one thing we have to understand is all these data, it depends on where it's collected from. So
Okay.
if it's from the city area, we have more of, what you said, obesity. If it's a village area,
Hmm.
they may be malnourished. So it depends on what cohort of children. So these studies are done in different
Hmm.
demographics. So which kind of children have been observed and taken.
Hmm.
Usually, what do they call as a exclusively proper breastfed baby is somebody who's not been given anything other than breast milk
Okay.
till at least 6 months of age, right from birth to 6 months. So nothing has to be given. So most of the time it happens.
Hmm.
Now, like I said, lots of mothers have other comorbid illnesses like blood pressure. hypertension, diabetes, infertility, and because of, like I said, the late age. So these mothers tend to have complications during pregnancy. So the baby may be small. A baby's average weight is around 2.5 to
Okay.
3 kg. So if it's less than 2.5, less than 2, the baby is considered as very small baby. So those babies are not able to
Okay.
maintain adequate sugars in the body, adequate temperature. So they need what is known as NICU care. They are shifted
Hmm.
into neonatal units. So over there, you cannot breastfeed a baby. If the baby is serious, you cannot breastfeed. Then the baby goes on IV fluids and then formula, and then we
Hmm.
initiate breastfeeding. So that could be one of the major cause of
Hmm.
these your data coming up wrong. Second thing is
Okay.
many of these mothers, because of this apprehension of not being able to breastfeed, causes more problems in breastfeeding because they read too much about it and they have so much of data. Now, what we have to know is
Okay.
breastfeeding is all controlled by the brain. The more relaxed you are, the more easily you can breastfeed.
So it
So,
all depends on how
yes,
fresh
if
and calm and
yes,
relaxed
yes.
you are.
So there are areas in the brain known as hypothalamus pituitary. They are the ones which release the
Okay.
hormones which causes the breast milk to start and breastfeeding to start. If the mother
Hmm.
is tense, nervous, or having any of the issue, then that milk doesn't come out.
Hmm.
So I remember our professors in pediatrics used to say,
Hmm.
breastfeeding तो बहुत आसान है. You go on any road and see, even those workers वहाँ पे बैठे होंगे वो आराम से बैठ के breastfeed करते हैं. No, because they don't have any stress. You see the road पे बैठे लोग हैं, the workers or those beggars selling things. आराम से बैठ के उनको कुछ टेंशन नहीं है. तो उनको तो दूध आता है, कुछ प्रॉब्लम नहीं है, कोई कुछ
Hmm.
सोचता नहीं है. But it is the ones which think too much, एंशियस हो जाते हैं, टेंशन ले लेते हैं, होगा कि नहीं होगा, फिर होता ही नहीं है. One of the major problems, yes, one of the major problems we see is this, and plus pressure, parental pressure, social media pressure. Did you feed or no? पहले दिया कि नहीं? उसको कुछ पिलाया क्या? तो ये सब जैसे ही डिलीवरी होती है, ये सब क्वेश्चंस शुरू हो जाते हैं. This is out of first-hand experience, I'm so that is why I say shut off
Wow.
the phone. You sit quietly with the baby, and any mother can feed the baby. There has never been any problem. This, as soon as the baby is born, there is something known as breast crawl. So as soon as the baby is born, we just put the baby on the tummy. So there is, you can see the baby slowly wriggles and goes up towards the mother's breast and starts suckling. The moment you put the baby near the breast, he smells because the baby can smell. No? He smells the mother's scent, smells the milk, and starts opening
Okay.
his mouth and starts to suckle. So babies know how to do this. You don't have to teach them. You just have to help them.
Hmm.
But it is anxiety of the mothers, that happens. So this data. Yes. So this data is because of that. Otherwise, all of us try and instill exclusive breastfeeding. So we usually don't give any water or honey or formula
Right.
or cow's milk or anything to the babies who's born. Unless, like I said, there are any complications, the baby's in the neonatal care, the mother is not fit in the ICU, then the babies have to be fed.
Okay. So, like you mentioned, good mental health is very important in milk production. And do we understand that mother milk has valuable benefits? So, if a kid is not optimally breastfed, does this increase the risk of any serious diseases later in life? कि type 2 diabetes होने के chances ज़्यादा होंगे और इम्यूनिटी विल बी वीकर ऐसे कुछ केसेस या इश्यूज रहे हैं.
Not at all. See, ऐसे मैंडेटरी नहीं है. सो इट्स नॉट अ कॉज एंड इफेक्ट कि फीड नहीं किया तो ये
Okay.
हो ही जाएगा. Breastfeeding करेंगे तो it is protective. There are immunoglobulins, protective factors in the
Hmm.
milk. So the milk when it comes, initially the first 1 or 2 days is what is known as colostrum. उसको चिक जो बोलते हैं हिंदी में चिक बोलते हैं. Cow's milk का भी चिक निकालते हैं. They may, when the cow also delivers, वो चिक निकालते हैं येलो वाला और उससे चीजें बनाते हैं.
Right.
Same way humans also produce that चिक. It's known as colostrum, yellow, thick one. So that has the highest content of antibodies, protective factors, IGF, जो ये सब diabetes वो सब prevent करती है.
Hmm.
इसीलिए initiating breastfeeding earliest possible within 10-15 minutes of delivery is important. God forbid some issues happen and in breastfeeding initiation doesn't happen. There is no harm, even though nowadays the formulas also almost simulate breastfeed. So the baby does
Okay.
well. I have not seen any major illnesses coming up in babies who are deprived. Now, if you see orphans, who are abandoned, we see a lot of orphans also. Babies after delivery only they're given away. They are left. They are not they are initially sickly
Okay.
because they lack breastfeeding. Of course, they get illnesses and everything. But long-term side effects ऐसे कुछ होते नहीं हैं. Usually they do well as long as other parts of the upbringing, like nutrition after that. तो ऐसा नहीं है कि आप बस ब्रेस्ट फीडिंग किया 6 महीना उसके बाद उसको बिस्किट चॉकलेट सब स्टार्ट कर दिया और उसको डायबिटीज नहीं होगा ऐसे नहीं है हाँ, तो पहले ब्रेस्ट फीडिंग उसके बाद देर इज अ वे टू स्टार्ट फूड्स यू शुड अवॉइड गिविंग नाउ दूध बिस्किट इज वेरी कॉमनली गिवन इन महाराष्ट्र गुजरात फॉर बेबीज एट
Right.
6 months when we start food the first thing they ask us can I give doodh biscuit so we say no no
If we understand the timeline, under 6 months,
is exclusive breastfeeding
okay.
nothing else.
Hmm. And after that, we can start the
Yes,
solid
we
food
start supplementary
gradually,
food.
right?
Yes, so we start complementary feeding along with breastfeeding at 6 months. So initially, we start rice water, soups, vegetable soups, all that we start.
All right. So now I want to understand the difference between breast milk and formula milk. क्या benefits हैं और क्या disadvantages हैं?
So formula milk का कुछ benefit है नहीं. That is only a substitute when there is no other option. So it cannot be recommended to anybody. It is only given when you don't have the breast milk.
Hmm.
So breast milk का तो
Right. Yeah.
yes, it's just an option. Yes, it's the last option for the sake of it, but it's almost similar. The companies make it almost similar to the breast milk, except of course the
Hmm.
natural antibodies and all
Hmm.
nobody can add. You cannot man make everything.
Hmm.
You can make some things, you can't make everything. So both add make us. They
Hmm.
try their best to add so that the babies are given as something similar to breast milk.
Hmm. Comparison. Understood. So now that we are on this topic, I also want to touch upon this aspect that some kids are very aggressive or throw tantrums. So are there any ways that parents can manage or prevent this behavior at early, like skin to skin touch or affection or any other way that जिससे बच्चे पर अलग
Contact.
असर होता हो?
So one of the benefits of breastfeeding is when maintaining temperature. No? So for small babies, it's very efficient. So that's what we know as kangaroo mother care (KMC). So babies are put on the mothers directly on the mother's skin, so that the mother's warmth goes to the babies and maintains that temperature. So any human being requires that personal, that skin to skin touch
Hmm.
and a little bit of affection, embracing. That
Okay.
obviously produces the good hormones, like we keep reading in all the posts. So that's what breastfeeding also helps in. Not only breastfeeding,
Right.
the father also can play a role. So we generally prepare the fathers. So after breastfeeding, we ask the babies to be burped.
Hmm.
They have to be put on the shoulder and burp. Otherwise, they vomit or they may have colic. So that can be done by the fathers. So usually we tell them, "यहाँ कंधे पे ले लो,"
Hmm.
rocking movements. So some babies can be colicky, excessive gas production.
Hmm.
So उनको ये सब जो maneuvers है
Okay.
rocking them, soothing them, gently singing nice
Hmm.
songs. So it helps in this
Okay.
bonding. So the babies usually recognize voices. So
Right.
वो अंदर
Hmm.
even in the tummy they are listening to all these voices. When they come out and they listen, they feel
Okay.
more protected and familiar. That is why
Okay.
we say the mental well-being of the mother is very important Because over the years, I have seen those mothers who have disturbed pregnancy or disturbed
Okay.
interpersonal relationships. Generally, the children are also very irritable, cranky,
Hmm.
and mothers who are anxious produce anxious babies. They're always cranky, not very happy. Small
Hmm.
things they start crying. So it is the overall environment which
Hmm.
is important for the baby. So we all have to remember that if you're deciding to bring another life into this world, you have to provide the optimum environment.
Okay.
If you can't, do not produce because everything has to be good so that the child also. Then you can't say the child has ADHD, autism.
Hmm.
Now take for therapy, do this, do that. It becomes very difficult.
All right. So my another question is, now that we are surrounded by screens, I mean right now even you and me are talking through screens, right? And मैंने काफी आसपास देखा है, if a kid is not eating, मम्मी लोग उन्हें फोन या टैबलेट दे देते हैं कार्टून देखने के लिए. And I personally believe this is not the right way. This is not healthy for kids. एंड इवन इफ हम मन बहलाने के लिए या सो दैट दे फिनिश देयर फूड, अगर हम ये कर भी रहे हैं, सो व्हाट हाउ मच स्क्रीन टाइम इज एडवाइजेबल फॉर किड्स?
So screen is absolutely no for children. Best avoided, best postponed as much as possible. During eating, screen is the worst because even all the scriptures say when you eat food, you have to see the food, feel the texture, chew and then eat. Then only it absorbs well and you get all the benefits. Now, children who see the screen and eat, they don't swallow, they don't chew at all, and they just swallow the food. So nothing gets
Okay.
absorbed. Then they end up getting constipation. Most of them are obese also. They're nice and fat, but it's all because of screen. The moment you stop the screen, they stop eating. It also leads to a lot of behavior problems because they want to do everything that the screen is showing them. So I've seen lots of children speaking in that YouTube language. They have that accent. They are not able to understand their mother tongue. They can't converse. They can't converse with normal people with eye to eye contact. They can only see
Okay.
screen. So many of our children, we have a lot of lots of cases being diagnosed of autism, and hyperactivity post COVID era again because everybody was cocooned in the house. Everybody had screen access. All the children were given phones, online school or whatever it is to keep
Okay.
them occupied. So immediately after COVID, 21, 22, 23, we had lots of these newborns, babies, 9 months, 1 year, who had problems in social behavior, delayed speech, unable to no eye contact. Usually, when a child comes, they look directly into your eyes, smile, speak, but they would look here, there, no response. Lots of them have had therapy. Of course, it's improving with all the social media, awareness about avoiding screen, but it's still not very good.
या whenever I see any kid around me and वो अगर खाना नहीं खा रहे हैं, so
Yeah,
mother will either give off the
yeah.
tablet or phone.
That's
Yeah, this is also there कि
that's
मेरे
absolutely
बच्चे को
wrong.
तो मुझसे अच्छा फोन चलाना आता है.
And that's a case of
Okay.
थोड़ा वो
Hmm.
प्राइड आता है कि देखो मेरा बच्चा स्वाइप करके खुद खोल देता है, देखो यूट्यूब भी खोल देता है, 9 months, but that's आगे. But that's very wrong. That's absolutely
Right.
wrong. Less than 1 year, no screen. Only for video calling. If grandparents are outside, then the screen is allowed to, for the video calls. That's all. Above 1 year, 15, 20 minutes. 2, 3 years ke baad hi, half an hour, 45 minutes is recommended. That to nursery rhymes, age appropriate screen. You cannot show them YouTube videos of TikTok or some movies and all. No, maybe
Okay.
nursery rhymes or some teaching literature. Less
Hmm.
than 1 year, absolutely not recommended. So there
Hmm.
are guidelines by associations which says this is what the screen limit has to be.
So you mentioned that because of screen timing, बच्चों का बोलना लेट हो सकता है, एंड काफी सारे पेरेंट्स का ये कंसर्न रहता है कि मेरा बच्चा लेट बोल रहा है. So, are there any other concerns that you would like to highlight?
Yeah, so one of this is delayed बोलना, दूसरा है interaction नहीं करते, तो वो पहचानते नहीं
Okay.
किसी को. They don't want to speak
Hmm.
to people. They only know how to speak to the screen. उनको interact
Okay.
करना नहीं आता, तो वो response नहीं देते. So lack of social interaction, we say, we diagnose it. So by 9 months, before that
Right.
also, generally the child responds. When he sees an adult or any other child, he has good eye contact. And you smile, the child will
Hmm.
smile. You ask something, you show a toy, it will smile. So these children sometimes they don't understand anything. So like the lack social delay, speech delay,
Hmm.
and then when this prolongs for a long time, there's no therapy done, then it leads to
Hmm.
hyperactivity because the child is not able to express.
Okay.
Expression has to come. So if he's not able to speak, then gets irritated. वो बोल
Hmm.
नहीं पा रहा है कि मुझे ये चाहिए वो चाहिए पेट दुख रहा है.
Okay.
By 1.5 years they start speaking, mama मुझे chocolate दे
Right.
दो, but they can't say.
Hmm.
So then aggression starts. Then they start hitting, biting. So
Okay.
all this is a consequence of the small thing known as screen.
Okay. So, my another question is for working mothers. They resume their jobs just 8 to 9 months after delivery. So, balancing work and breastfeeding can be challenging, right? How they can manage this effectively and how families can support them during this time.
So nowadays, what happens is they have lactation leaves. So most of the companies they allow them to prolong it for another 3 to 6 months. 6 months तो mandatory ही है. फिर up when the child becomes 6 months, उसके बाद भी 3-4 महीने दे देते हैं आगे. So
Okay.
6 महीने में usually हम weaning start करते हैं. Like I said, we include other food substances. So we start supplementary feeding. 6 महीने तक exclusive feeding. उसके बाद हम ऊपर का खाना भी थोड़ा
Okay.
थोड़ा start करते हैं. Of course, you can't give 3-4 times. It is only adding, helping the breastfeeding. Second option, what many mothers have is work from home. So they are able to manage the breastfeeding a little
Hmm.
better. But for professions like us who have to be on the go, doctors can't sit at home and work. There are
Okay.
many others who do that. So for us, we advise them to pump milk
Hmm.
and keep. So breast pumps are available now. So when they remove the milk, there are different shelf life. So in if the temperature is like rainy season or winter, you can keep the milk out for 2 to 3 hours. Otherwise, you can keep it in the fridge or in the freezer. And whoever is the caretaker can just thaw and give the milk to the baby. So we do provide them with options, and as per the mother's working time, no? And generally some of them have close, the
Right.
offices are close by. Or nowadays, many of the MNCs have creches in the office. So they take their babies along to office, and the baby's
Okay.
left in the creche. And every 3 hours they go and feed the baby over there. And when they come back home, they bring the baby and come back home. So many of these MNCs have creche option also. In the office itself, they have tie-ups. So the babies are managed well, mothers are also relaxed, and breastfeeding continues, and the food feeding also starts.
Wow.
So one thing I forgot to say is with relation to breastfeeding and pregnancy after delivery, many of the old timers like our parents, grandmothers, there are certain things
Okay.
that they say do or don't do.
Hmm.
ये खाना वो नहीं खाना, ये ज्यादा खा लो, वो मत खाओ, लड्डू खाओ,
Okay.
राइस मत खाओ, क्या सिट्रस मत खाओ, बनाना मत खाओ. So you cannot say no to them every time. Sometimes there
Right.
is some substance in it also because naturopathy, Ayurveda, and all follow different rules of eating. But generally, what we tell our
Hmm.
mothers is you eat what you used to eat before. Don't change your diet drastically. Nothing has to be avoided once you have once you're pregnant, except the
Hmm.
substances or Chinese food is contraindicated. Outside food is not recommended too
Hmm.
much because of hygiene issues and everything.
Okay.
So otherwise you can eat everything, rice, वो banana, fruits,
Hmm.
वो सब खा सकते हैं, कुछ होता नहीं है उससे.
Okay.
Then you have all these additional things which they give to
Right.
enhance
Hmm.
breastfeeding or to enhance the body. So laddu banate hain, methi ka laddu,
Okay.
ding ka laddu, and they give all that laddus.
Okay.
So some of these, yes, all.
I mean,
So
this
some
is
of them are
new.
good for the body of the mother. Like methi is supposed to make the bones stronger. Then there are some dink and all which produces more milk, which acts as a
Hmm.
galactogogue. So there is no harm in giving. So as long as it's not harmful, we do not stop these practices. We go along with it because you cannot
Okay.
contradict everything what your old people or say. फिर तो वो मारामारी हो जाएगी घर में तो हम बोलते हैं जो सूट होता है वो सब चलने दो जो
Okay.
बहुत एक्सट्रीम है मीन्स से हनी दे दो या दो दो स्पून घी डालो हर खाने में तो इसकी जरूरत नहीं है ना यू डोंट हैव टू ईट डबल यू ईट एज मच एज यू फील हंग्री दो दो चम्मच घी डालोगे वो फैट तुम्हारे अंदर ही जाएगा यू विल हैव टू एक्सरसाइज डबल एंड लूज दैट वेट लेटर
हाँ, दे
सो
से दैट थोड़ा और खा लो कि बच्चे को भी अच्छे से न्यूट्रिशन मिले।
नहीं
या
नहीं आप कम खाओगे तो भी दूध आने वाला है बट यू डोंट स्टार्व तो वी डोंट अलाउ देम टू स्टार्व और कीप रोजा
ओके।
और मेंटेन एनी अदर
हम्म।
व्रत or something like that. You eat as much as you feel hungry. All mothers who breastfeed, they feel hungry. Yes, and they do feel hungry. उनको लगता है भूख तो हम बोलते हैं कि तुम 3 3 घंटे में खा लो एक साथ किसी को भी
राइट।
अचानक 25 30 साल के बाद एक साथ खाना नहीं हो सकता बिकॉज एवरीबडी हैज अ स्टमक कैपेसिटी दो रोटी खा रहे हैं तो अचानक 4 रोटी नहीं खा सकता कोई भी अनलेस आई एम फीलिंग रियली हंग्री so what we tell them is हर feed के साथ. So you have breakfast, you have a mid morning snack, then you have lunch, you have a mid evening snack. तो ऐसे break करके खाना so that you don't feel full and your nutrition is also maintained.
ओके।
And certain myths are there. ये दूध मत दो, वैसा मत पिलाओ. राइट साइड से सिर्फ सॉलिड आता है, लेफ्ट साइड से पानी आता है. सो ये सब myths अलग अलग स्टेट्स की अलग अलग है. No? So it is only when you sit and speak. So we have dialogues and that is very important. No, they have to be in continuous. Initially it's with the gynac and as the
वाओ।
pregnancy progresses, we come into the picture. That is a pediatrician neonatologist. तो फिर डिलीवरी के बाद पीडियाट्रिशियन का मेन रोल है देन लैचिंग करना कैसे भी खाना खिलाना दूध कैसे पिलाना है मेंटल हेल्थ तो डायलॉग विथ योर डॉक्टर इज वेरी इंपॉर्टेंट कि सब चीज सबको पता नहीं
वाओ।
होती है तो तभी ये that helps
ओके।
when they keep we keep talking to them they keep talking to us they keep
ओके।
asking us so that plays a good role in and emotionally also then they're stable they know they're relaxed they know somebody's telling us right thing और वो स्मूथली फिर ट्रांजिशन हो
I
जाता है
think I have received a lot of information, and what I take away from this for my future self is to keep calm, relax, exercise regularly, and be in a healthy environment.
yes yes we have to remember it's not an illness. It's not an illness. It's a normal thing, transition. So you maintain a good environment emotionally, physically, eat well, be happy, and go along with the process.
So my follow-up question on this, that we share a lot of advice with mothers, but father के भी काफी roles रहते हैं, right? So do they come along for
Yes,
consultations?
yes, yes. So the counseling is always done with the couple. अकेले का नहीं करते हम कभी. दोनों and the
Okay.
mother-in-law and mother.
Hmm.
No, otherwise it becomes a big problem. So it has to be with the mother, father, their parents also, or whoever is the caretaker. Because what happens is if I tell the mother something and she goes and says that, it
Right.
becomes a fight. Why are you saying? When it comes from a doctor, then they listen. So we always do wholesome counseling. So everybody is there. We ask them what their doubts are. Then we tell them this is what is right, this is what is wrong, this is what we recommend. Suddenly one fine day, if you go and tell somebody, no, don't do this, they won't listen. So we tell them ये pros and cons है. We advise this. आप अभी समझ लीजिए ऐसे. So father का
Okay.
तो major role है in terms of like I
Hmm.
said illnesses also you have to check
Hmm.
in the family history addictions have to be in the this passive smoking and the father also can cause problems for the baby.
Okay, so it's not just the
Yes,
mothers who need to
not at all.
avoid all of these
No,
substances,
no,
but
no.
father ki habits
Father,
be equally
yes,
important.
absolutely. It depends on the father, how he keeps the mother happy, how he takes care of her when he's around or no during pregnancy and delivery. He has to pay equal. Nowadays, they have paternal leave also for this lactation. So they also have. advised to be with the mother, take care, because mother has to take care of her health also. No, she's also delivered. She has her own wounds. She has her own stitches, and the baby also is there. So they need as much as help as possible, and nobody better than the father because he also understands his baby better.
Very true. I find all of this so interesting. I mean, is there anything else that you would like to add?
But generally, it goes on smoothly. Nowadays, even though with a lot of stress and everything, the parents are very understanding.
Hmm.
They know they want to
True.
have an, and
Yes.
now nobody wants two
Hmm.
children. So economically or physically viable नहीं तो
Absolutely.
एक ही but usually they stick to one child. So they want to give the child their best if they're having. So most of them are aware of all these things. So that is one thing which is good
Okay.
also. They know that now I have to be calm. They go into spirituality. They listen to a lot of mantras, Gayatri, Garba Raksha,
Absolutely.
Gayatri mantra. Most of them want normal delivery. They prefer doing that. It's a very, it's a nice phase, where you have
Okay.
everything and it's evolving very nicely. Ultimately, the end products are very cute bundles of joy who give joy to
I could sense.
everybody.
So another question just popped in my head that back in the days, normal deliveries बहुत common होती थी. But now people are opting more for cesarean deliveries. क्या reasons हैं इसके पीछे?
Because of our laziness, our lifestyle. पहले के जमाने में हमारी मम्मियाँ बैठ के झाड़ू पोछा करती थी, नीचे बैठ के सब
Hmm.
कोकोनट वगैरह करती थी, बर्तन मांजती थी. They used to do all physical work. Toilets were Indian, तो हम नीचे बैठते थे.
Okay.
सब कुछ करते थे. Our pelvic floor,
Hmm.
that is the muscles which are around our uterus
Correct.
were strong that time. तो वो सब डेवलप होती थी. So they were able to pass the vagina and all. They would prepare very well. They would bear the labor very well. They were able to push out the baby. Now with all the lifestyle
Hmm.
changes, commodes आ गई हैं. अभी वैक्यूम क्लीनर करते हैं या फिर वो बड़े मॉप से करते हैं. Nobody sits down. We don't even sit
Okay.
down and eat food. Dining table पे बैठते
Hmm.
हैं. I doubt any of us can squat on the floor also or sit cross-legged on the floor. So our muscles have become very bad. इट्स वेरी वीक. प्रेगनेंसी होल्ड करना उतना ही कर सकते हैं कि कुछ फ्रैक्चर नहीं हो, बट द होल प्रोसेस डजंट हैपन. But if you are active, you do maybe you
Wow.
can't do everything in the house when we are working and all, but at least do
Okay.
yoga exercises, swimming here.
Okay.
And if your muscles are good, then definitely normal labor is possible. We have seen a lot of mothers, they do have normal labor, but that should not be a
Wow.
focus of stress. ऐसा नहीं
Okay.
है कि cesarean is bad or anything.
Okay.
Normal नहीं हुआ तो cesarean. When a gynecologist takes a
Hmm.
decision to do a cesarean, it's always in the best interest of the mother and the baby. That's the last option usually.
Okay.
अगर कुछ नहीं हो रहा है तो ही cesarean करते हैं.
Okay. So, can you recommend some movies for moms who are in labor?
Mother should watch pleasant movies. So I say कि ये सास बहू serial और वो सब मत देखो. They should watch more of
Wow.
cartoon movies, funny movies, जो
Okay.
हंसाती है. अच्छी चीजें वही देखनी है. Violent
Okay.
movies and whatever they make nowadays, all these slicing necks and
Hmm.
killing people and all should not be
Hmm.
watched. Not
Right.
mothers, not children, not during
Yeah.
pregnancy, delivery, nothing. Because it creates that subconscious things in your mind. You get scared and apprehensive when you see such things. So be
Hmm.
happy, pleasant चीजें
Right.
सुनो, pleasant चीजें देखो, travel करो, vacation पे जाओ, enjoy करो every time. That's the best.
Okay, so speaking of traveling, I just remembered something. I was chit chatting with one of the friend who's also a travel content creator, and she mentioned that she was traveling all around the world and taking up flight when, uh, up till she was, I think, 7 to 8 months pregnant. So, and it was all super fun and easy for her. So, I want to understand, is it advisable for traveling when you're in
Yeah.
labor?
So you do what you normally do. So if you like travel, you travel. So pregnancy is not a contraindication, but generally after
Okay.
7 months, 8 months, the airlines don't allow because there are chances that lady may go into labor pains in flight and there may be problems. So
Hmm.
after the seventh month, generally they don't allow pregnant women to travel nearing the pregnancy because it can be a complication later.
So till 7 months,
Huh,
it's okay.
it's allowed. So once the
Hmm.
first 3, 4 months are done and your pregnancy is stable, so every scanning and all is normal, your baby is normal, then the gynac gives a go ahead. You can do what you want. So you can travel, and as long as everything is fine, there is no harm. So you have to do what you're happy with.
Okay. Also, you mentioned exercise करना काफी जरूरी है for a normal delivery, but with sedentary lifestyle, for some people it is very difficult to take out that 1 hour and go do workout.
Generally, we advise that everybody has to do some form of exercise, half an hour, 45 minutes, either cardio or some other exercise, aerobics, Zumba, hair,
Hmm.
yoga, hair, whatever
Right.
suits you, depending on your. And when the couple starts, they want to plan a pregnancy, the mother is always told you have to be active.
Walk around.
So you go about doing if it's a sitting job, like always sitting in front of the computer, then we tell them, take out half an hour. थोड़ा
Okay.
जल्दी निकल जाओ. Half an
Hmm.
hour, 45 minutes walk around, join some class, start some. Yoga is good because it stretches your body. It makes your spine strong. Your spine is
Hmm.
important to maintain all your other bones.
Right.
That is what. So that's how yoga helps. So it maintains your spine. And if your spine is strong, then you can withstand everything. Your pelvic
Okay.
bones are in place, your muscles are nice and strong. So there's no chance of any complication
Hmm.
happening also, like a preterm delivery or any miscarriage. Usually doesn't happen. Your blood pressure is maintained. All your
Hmm.
sugar level. When you exercise, automatically your sugar levels are also stable,
Hmm.
so you don't have excessive cravings to eat. So exercise maintains everything, so it makes your body perfect for this event. And then later on also,
Okay.
then everything passes smoothly, so you don't have any problems during pregnancy. Some of them get diabetes during pregnancy because of a sedentary lifestyle and
Hmm.
everything. So there is something known as diabetes induced during pregnancy, and it goes off at times or it stays after delivery. So this is all.
So it has an effect on the baby as well.
Yes, absolutely. So babies born to diabetic mothers have to be monitored in a different way because they have those sugar levels keep going up and down.
Okay.
So anything that happens to the mother can cause a damage to the baby.
Hmm.
So what we recommend is that we all want to work. We all want to work, earn money. But ultimately, what are you doing it for? To have
Hmm.
a good life, to have a good offspring. So maybe you can cut that half an hour,
Hmm.
1 hour, and try and do a little bit of exercise from your schedule
Okay.
so that you can have a prolonged life and a better quality of life. There's no point in having money to spend in the hospitals, right? You have to have a good quality of life. Your children have to be healthy, otherwise, you'll be
Okay.
spending money only on doctors and hospitals.
All right. So, what one should do in this
Yeah,
situation?
premature babies are totally different entities. So it's a big chunk of lots of complications and special care, special
Okay.
NICU. They have to be
Hmm.
handled. Even the milk is special for them. So we have what is known as milk banks now. Milk bank. Like a normal bank, you have milk bank. So some of the hospitals like Sion, Surya, they
Right.
have exclusive neonatal or children's hospitals have milk banks. So those mothers who have excess milk, those who have already fed their babies, so they are allowed to donate milk to the milk bank. I have also read that milk is available
Hmm.
online also. That's a different that's a different
Okay.
section.
Oh,
Yes.
this is new
So
to me.
yeah. So milk bank, the milk from the milk bank is used for these small babies. Those mothers who can't, so they are born sometimes at 7 months, 7.5 months. So they are not able to feed on their own. So we have to put in a tube from their mouth and then directly milk is given into the stomach. So in that we generally don't use formula milk because it can cause more complications. So breast milk is only recommended that either the own mothers or from milk bank.
Okay. So a mother can produce milk even if she has a premature kid?
Yes. As soon as the baby is born, the milk starts coming. In fact, during pregnancy, only milk starts coming from the breast. That is a different entity, how to take care of the breast, and so that you have optimal, you
Hmm.
can feed the baby properly, and there is no other issue.
Anything else that you would like to add to this?
Yeah. So with respect to the breast issue, what we generally see is,
Okay.
babies are massaged when they are born. So there are these
Hmm.
dedicated guys or maids who do baby massage, and they charge exorbitantly also. So what they do is they put oil in the ears, they put oil in the nose,
Hmm.
they massage the breast, and they do the rest of the massage. So oil in the ears is not indicated. Oil in the nose, not at all. It causes pneumonia. Massaging the breast, what happens? Why do they massage the breast? Because babies produce milk from their breast because of the maternal hormones. So the maternal hormones pass. So some babies can have a little milk discharge coming. The breast may be a little swollen. So these people remove it out. They squeeze and they
Oh,
remove.
yeah, I
That
have
leads,
seen.
yes. So that leads to infection. The breast gets infected
Oh,
of the
God.
babies. When it heals, it pulls the nipple inside. So instead of the nipple being outwards, the nipple goes
So,
inside.
what could be the side
Now, if
effects?
it's a boy, so one complication is it may cause an abscess, it may cause a wound, which is a little difficult to heal. We may have to
Okay.
cut and remove the pus.
Hmm.
Second thing is when it heals, it goes inside.
Hmm.
The nipple goes inside.
Okay.
These babies, when they become mothers, they may
Hmm.
have problem in breastfeeding.
All right. So,
Okay.
what one should do in this
So
situation?
when we examine babies, when we examine the mothers during pregnancy, we check the breasts also. कि nipple
Hmm.
कैसा है? How is it? Is it flat? Is it retracted? Is it normal? Though actively pulling the nipple out is not advised during pregnancy because it can
Okay.
stimulate your uterus also, and the mother may go into preterm labor. But little mildly, they can put coconut oil or any lotion and try and keep it healthy.
Okay.
Then after delivery, we have lots of things that we do. If the nipple is not proper, then we have syringing, we use shield, and so that the baby is able to latch properly. So this is another advice: do
Hmm.
not tamper with what is normal. Excessively massaging, excessively squeezing things, putting
Okay.
oil in all the holes, not advisable.
So these old practices, we
Some of
should
them
partially follow them and partially not.
partially, which are
I mean,
dangerous, we need to
specifically, if
avoid them.
I mention one thing which has been followed in North India, this ritual that छोटे बच्चे को पैदा हुए बच्चे को शहद की
हाँ, वो
गुड्डी
नहीं
पिलाई
देते,
जाती
दूधी,
है.
हनी, वो सब देते, तो वो सब एडवाइजेबल नहीं है.
So what could be the side effects?
Anything external you give will cause an infection. Plus, you don't know what it contains. So many of these Ayurvedic medicines, they have serious side
Okay.
effects, the liver
Hmm.
toxicity and everything. Babies' livers, as it is immature.
Hmm.
So you give more of these medicines, they may cause other problems.
Okay.
Plus, when you're giving exclusive breastfeeding, you
Hmm.
give when you give something
Hmm.
different, एक तो उसका infection, heart का infection, वो सब मुंह
All
में,
right.
so they tend to get diarrhea and lose motions.
This has been such an insightful conversation, Dr. Murthy, and I'm sure a lot of couples or new mothers will have their question answered in this episode.
I would like to end with this only that everybody has to take care, be healthy, stay normal, don't think too much, stay away from social media. That only helps. And you know your
Hmm.
baby the best. There's nobody who can't feed or can't doesn't produce milk.
Hmm. Right. Parents' instincts are very strong.
Yes, absolutely. Yes.
Thank you so much for joining us today, Dr. Murthy. It was an insightful conversation.
Thank you very much. My pleasure.
And to all our listeners, thanks for tuning in. Be sure to join us for another insightful episode of Journey of Giants. This is your host, Megha. Please subscribe us, leave a comment if you have any further questions from Dr. Moorthy, and follow us on social media for more updates and information. Till then, be healthy and happy. Goodbye.